welcome to this joint work session of the Eugene City Council and Lane County Board of Commissioners. I now call the July 28, 2021 City Council work session to order. You're muted still.
There's always one, and I hate being the one. Ditto to what Mayor Venus said, and I now call the July 28, 2021 Lane County Board of Commissioners work session to order.
Oh, gosh. All right, sorry. I continue to be having problems with this. Sorry.
That's okay. That's why I don't follow the script.
I'm coming. Okay, here we go. Thank you for joining us in this remote meeting format we're using as our state and community recover from the COVID-19 pandemic. This format enables us to meet and take care of business while keeping everyone safe. For work sessions like this one, where there is no opportunity for public comment, those wishing to access the meeting can do so by watching the live stream available on our website, the broadcast on Comcast Channel 21, or by calling into one of the phone numbers listed for this meeting on the public webcast and meeting materials web page. And as always, other forms of communication with me, the city councilors, and the commissioners are available, including email and voicemail. Thank you again for joining us. And then with that, I am turning it over, I think, to the city manager.
Thank you, Mayor and Council, Chair Bernie and Commissioners. I first want to just start by offering a lot of gratitude for us all being able to have this meeting today. I know it wasn't easy to do, and I know it's a very important topic to all of you. So I'm just really grateful that we're able to do this before we have a summer recess. I'm excited about the information. It's been a pleasure and not always easy, but I've been so excited to work with the county and with Steve in particular on how we move this together, how we move all of this together, forward together. Just how many times can I say together? So we're joined here by a lot of talent, in particular Sarai, who is going to give us a presentation and have plenty of time for you to provide comments and feedback on our kind of current status update. So thank you again for today.
Thank you. Do I take it away now, or am I stepping on a procedure? Okay, all right, thank you. Echoing Sarah, thank you so much for being here. Chair Bernie, Mayor Venus, councilors, commissioners. It's amazing to always be able to have an opportunity to share with you what has been happening around homeless systems transformation and, you know, the 10 TAC recommendations along with other things that are going on. So looking forward to sharing that all with you today. Can everybody see my slideshow?
You can see it.
Okay, excellent. So we're going to go ahead and give a good overview of what we are doing that kind of edges out beyond the 10 recommendations that were provided by Technical Assistance Collaborative in the Lane County Shelter Feasibility Study several years ago, and talk a little bit more about kind of widening the frame, as I believe Mayor Venus put it, to talk about other joint city-county efforts around homelessness. Then we will dive deep into those recommendations found in the homeless systems analysis and shelter feasibility study, and talk more about the outlook on that and our budget on those items. We'll then talk about really clearly what we're doing this fiscal year, what top priority projects will be completed by July 1st, 2022. And then finally, an overall kind of quick view assessment on our performance so far, how we're doing, and where we have room for innovation. And as we go through this, I am really looking forward to hearing your comments and questions and thoughts on this. This is our current attempt to truly prioritize and put into play all of the resources we have available. And we also have identified areas where we may not have the resources we need to get things done just yet, but want to phase those things in. And so we'll be looking for your input on whether we're getting these priorities right or what other ways we might want to move forward together. Right now, the city of Eugene and Lane County are working not only on these 10 recommendations, as you know, we're also working together on a number of other things like locations for safe sleep villages and sites in the city of Eugene. City Council has made some really unprecedented strides on this front this year that I think is really valuable to acknowledge, that we've been able to first in the fall, have council approve up to 100 new rest stop beds. And now we also have the shift in ordinance that can allow more camping and car camping on a location. And that effort, looking for those locations and identifying where they are and how we can use them, has been a joint effort that the county and city have pursued for quite some time. The infrastructure into that is the city's work. They also support operations and also have been doing a great job of coming up with new ways to address responding to the unhoused community, especially those who are living in places not meant for human habitation. And I'd like to point out that the city of Eugene is actually a leader on this front up and down the West Coast. There's a lot of areas, cities in our own state that have started to ramp up enforcement of unsanctioned camping. Well, the city has balanced really carefully the CDC guidelines that are still in place at this time and have not changed, as well as recognizing that we have such a large community of people who don't have a safe place to sleep at night, that our response needs to be bigger and broader and more deep. Lane County is, of course, collaborating on those locations, homelessness services and anti-poverty work through the continuum of care and the community action agency designations, and also bringing to bear the work and the lessons that we're learning in partnership with the city of Eugene to the entire county as well. So these pieces play together well. Lane County and city of Eugene are collaborating, and you'll hear more from James Ewell from the county and Peter Chavan from the city in just a few minutes about what that's looking like in their particular realm. So this is a bigger list of things that we're doing together, is obviously implementing the TAC recommendations, working together on behavioral health response, the mental health summit, support at new sites, whether it's through service provider support or safety and emergency support. We're all working in a housing first framework, and we also have been starting new conversations about what hazardous weather strategies might look like, not just thinking winter, but recognizing that we have extreme weather year round at this time. And so we need to have a more coordinated response to that, especially where it comes to supporting our unsheltered neighbors when emergency weather happens. We have the land options team, and then the Safe Sleeping Sites collaboration, which is not just between the city and the county, but also inclusive of service providers throughout the community to try to develop something that can manage a major influx of additional spaces for folks, while also connecting them with services and helping people each on their own individual path toward getting into permanent housing. A few things that we're not going to go too in depth about today, but are useful to know about: rent assistance. There was a recent Board of County Commissioners meeting, I believe it's on the 20th of this month, that if you're interested, you could find, where there's a lot more information about how rent assistance has gone. But since last year around this time, the team at the county has been able to distribute millions of dollars of rent assistance to thousands of Eugene and Lane County households. The city of Eugene and city of Springfield also contributed funds to that. And so that is a great testament to being able to be nimble and respond to an emerging need as it arises. We also have seen, as I already mentioned on the last slide, a large expansion of alternative shelters, meaning places that may not qualify as habitable per HUD guidelines, but do provide a safe place for people to be, where they're allowed to be there and will not be disturbed and are able to stabilize in the place that they're at. We also will start seeing congregate shelter capacity inch up as CDC guidelines open up and OHA guidelines open up. At this time, most of them are holding steady where they're at, but we hope that will start to shift in the near future. Already mentioned hazardous weather response. There are ongoing conversations about that, both within service provider contacts and within the county and cities. Medical outreach and medical respite have also been topics that have gotten a lot of traction recently. And so we've been working with partners and with each other to identify the needs for those items and to support the organizations and providers who are out there doing that work. And then finally, capacity building. One of the biggest things that we've seen, one of the most unfortunate, I guess, results of the COVID-19 pandemic is that our response to needing to create more non-congregate shelter and create different interventions in a pandemic winter unlike any we had ever seen before, we have really taken capacity of all of our service providers working in homelessness to the edge, to say the least, and in some cases, maybe a little past the edge. So we'll talk about that when we get to our rapid rehousing topic. But one of the things that we do have is some funding and some plans to support capacity building for our nonprofit partners. And that is a work in progress, but we really do need to have that as a high focus for sure. Orient us to where we are in this process. Right now, we're in year 3. So the joint elected officials adopted the homeless shelter feasibility study, Lane County Shelter Feasibility Study in 2019. And now we are operating within our 3rd fiscal year. It's also just worthwhile to note that this is the fiscal year in which the intergovernmental agreement between the city and the county will need to be revisited and potentially renewed or adapted for the next few years. But this is actually kind of a good moment for us to take a look and step back for a second and see what is it that we need? How do we want to work this between us and together? And this is an adaptation of a chart you've seen most of the times. Staff has presented to you about this. This is our homelessness systems transformation 5-year implementation plan / implementation framework. And so giving you an update on this, I think is valuable, and it's sort of one of our guiding places of what did we think we would do versus where are we now. So in alternative shelter, when we first started this, we expected that we would expand services in fiscal year 1920, which we did. That was an expansion of beds at dusk to dawn primarily, and I believe went from about 120 to 225, and in some parts of the year made dusk to dawn go dawn to dawn. So that did happen. Of course, in 2021, we ended up having to pull back on that instead of maintaining. So that's why that's yellow, because it's like, oopsies, that wasn't really because of anything we did wrong. It's because COVID-19 hit town, and it wasn't possible to maintain that level of beds because we had to really adjust for physical distancing requirements to try to keep everybody as safe as possible. So that's where we ended. We didn't quite maintain all of that, but we were able to replace most of those alternative shelters from dusk to dawn with hotel, motels, pallet shelters, and some other of the creative non-congregate approaches to sheltering last year that we were able to implement. In fiscal year 21-22, which is where we're at right now, we had it, we expected to taper those services down because we did expect the navigation center to take up a bunch of the folks that maybe could leave dusk to dawn and come over to the navigation center to move toward housing quicker. In reality, I think we've all recognized over the past year that our unsheltered homelessness numbers, the number of folks who are living in places not meant for human habitation, has expanded greatly and is something that we really have to address in a different way. And so in this year, we're expanding services again through the city's safe sleep sites and through other efforts. And then in 22, the next fiscal year and the fiscal year after that, 23 and 24, we have it on here to adapt. And so what we want to do is calibrate the right number of alternative shelter beds to make sure that everyone in our community has a safe place to sleep, while also recognizing that alternative shelter isn't the final step for us. What we need is a place now, and then we need to be able to open up that pipeline into housing, which will require building more units and some other things, but we will get there. It will take some time. And then we have our low barrier shelter / navigation center. So in fiscal year 1920, we were supposed to site and design, but you'll note that I kept this green and then I crossed out design and put design in 21. And then we were supposed to build it last fiscal year. Of course, because of COVID-19, that wasn't something that was able to happen. So what we did do, of course, as you recall, is the county was able to purchase the building at 100 River Avenue last year and used it as an alternative care site for isolation and quarantine for folks who couldn't do that in their home during COVID-19. And now in this current fiscal year, we are building it and will be operational by July 1st of 2022. So we meet the requirements of the state of Oregon to receive the funding that they put on the table for this project in Eugene. So that is on track now, although we had a sort of slower start to it than expected. I think we'll be able to make up for lost time, and we will begin operation in the next fiscal year. Permanent supportive housing. This one is also, I just want to note that I've sort of shifted. We had been reporting on the units that were planned in any given year. And so we had 50 that we counted MLK Commons or Commons on MLK. In that, what I think is more helpful, and this is mostly for my own ability to help us get to this goal of 350 units, is to count those units in the years that they are finished and leased up. So that's the difference here. So we've taken this 50 units and then we'll have to distribute them throughout the rest of this time, but I think we'll be able to catch up. So in fiscal year 2021, we had MLK come online as well as Market District Commons. So that had 15 PSH units for veterans. And then of course, Commons on MLK has 51 units for Fuse clients, frequent user system engagement folks. In fiscal year 21-22, right now, we're looking for, we wanted to create 75 units by this time or during this year. Right now, we have 15 in the pipeline that will be opening in the next few months. That's Keystone, which is PSH for families. It's the one that's located at 13th and Tyler near the fairgrounds. So we aren't up to 75 yet this year. So we're gonna have to continue to build out this pipeline. We may be a little ahead of the curve for next year, though, where we have 75 units planned, but we will be bringing 95 online, most likely. So we have the Nell, which is beginning construction very soon. And then we also have the Bridges on Broadway project that has been intended to be PSH, which is likely. So that's around 50 units. It will be a little bit more than that if indeed it is used for that purpose. And then finally, we had 100 units scheduled for 23-24, and we will have to catch up with an additional 74 units here. So ultimately, we have about 176 either completed or in the pipeline, and we will need to complete another 174 to meet our target of 350 within this 5-year framework. And then, of course, this part of it is hiring the strategic initiatives manager, which is now the joint shelter and housing strategist. And that's me. So those things happened. To orient you again to our homelessness response framework, as you might remember, we are working under a prevent, support, house model. So our first line of defense is to help people stay in their homes. One of the other things that we're doing is deploying rapid resolution or diversion and rapid exit. They mean the same thing. That is under contract right now with Shelter Care. So we are piloting that this year and hope to learn from it. So of course, first we'd like to keep as many people in housing. We are using rent assistance for that as well, as you know. And then if that doesn't work, if they just at least go through rapid resolution, then they're able to skip over that support area and go straight back into housing. So whether it's diversion and rapid resolution to help somebody get a bus ticket back to where they're from or where their family is, or to, get into some decent shelter or a place to live right away, or if it's rapid rehousing or permanent supportive housing, then these are the ways that we're trying to help people get housed as quickly as possible whenever we can. And then, of course, when we are not able to totally do that and someone is experiencing homelessness, we are also bolstering our support. And so that's things like the city's planned day center, the low barrier emergency shelter, the alternative shelters we're working on, and other services. And these are also connected to our big goals of making homelessness rare, brief, and one-time or non-recurring. So prevention, hopefully will make it rare. The more that we can calibrate and perfect our supports and also add housing units so people have a place to move on to, the more we make that time spent homeless smaller. And then the one-time piece is making sure that people are able to retain housing once they are able to get into it. So on the progress implementation side, we have 4 cute little indicators that will tell us whether we're on track, at risk, off track, or paused. Some of these projects are not moving forward right now, not because they're not important, but because we don't have the resources to cover every single project all at once. And I keep saying project because what I'm seeing with the recommendations provided by Technical Assistance Collaborative is that each of them in itself is a project, and some of those projects are interdependent on each other. And so we've done our best to connect in which those are. And luckily they tend to fit underneath their kind of prevent, support, or house category. First, we've got expand diversion and rapid exit strategies or rapid resolution. The recommendation was 6 FTE diversion specialists. Currently, there are 3. We have $50,000 in annual diversion financial resources and have already provided training and coordinated service at shelter entry points. So I believe 6 nonprofits participated in a training by an outside provider, which was great. And our goal ultimately someday will be to serve 500 households with this annually. In this moment, we are not quite there, but we'll get there soon. So then we've got a budget of about $261,000 for this from Lane County. We also have support. We're going to talk about these projects a lot more in the next few minutes. So I'm going to keep this part brief, but essentially here is our support efforts, adding low barrier shelter, coordinated entry, street outreach, and training to ensure implementation of best practices. So all of those have funding. This 187 is actually funding that remains to be seen for coordinated entry changes, but we are continuing to work on all of that too. So these projects are all on track, and you'll learn more about most of those in a minute. This one is Landlord Strategies, create centralized and coordinated landlord and housing partner management. This is actually a pretty robust body of work, which is extremely important, but because it is so intensive and we have to make a lot of decisions about how we're hiring these folks, are they contractors, are we hiring within the county, or what is that going to look like? We have to add some staff capacity to do this. So we do have, the city of Eugene had set aside $60,000 for this purpose a long time ago. And then the state of Oregon, through, I believe, ARPA funds, the county has gotten some of those funds for this purpose. So hopefully we'll be able to put something together. I'd like to see this start to move forward in this fiscal year if we are able. And then, of course, rapid rehousing is kind of a similar story. We're implementing some of these recommendations as we can. So Amanda Borta has led this project, and she's been able to write up those written standards for rapid rehousing. And we have identified a large amount of funding. As you can see, we have a little over $2 million to increase our rapid rehousing deployment. What we don't have is, and which is making this project not necessarily move forward at the rate we need it to, is that it will be dependent on the coordinated landlord and housing partner management project. And it also, we have a lot of strain again in our provider community. And so people don't have as much capacity to deploy these resources as is needed. So at this point, we are really low on, or maybe don't have any providers for rapid rehousing targeted for single or partnered adults. So we are working on that, and there's a lot more work to be done on deciding and determining how to move all of this forward. Under housing, we've got expand and increase utilization of tenancy supports. That's partly going in tandem with rapid rehousing and implement effective move-on strategies. And move-on strategies, we've mostly kind of set aside for the future once we've got landlord work, rapid rehousing, and tenancy supports all done together, because they all do fit really well together. And then finally, we have our PSH. So this is a count, you have this in your slide deck as well, of exactly what we're counting on that, and again, what we still need to do. So this year, what we're working on is 3 projects. These are all really interwoven. So as we're moving these ahead this year, we're keeping in mind that they all need to work together. So we have coordinated outreach, coordinated entry in the navigation center. And I'm going to invite James and Peter to the scene to give you a little bit more information about each of those things.
Good afternoon, everyone. This first section is going to be a little bit of a review for the commissioners that are on the call from the board meeting last week, but just wanted to give kind of a brief overview of what street outreach is, and HUD really defines street outreach as its role being to engage unsheltered folks who might not otherwise seek assistance or come to the attention of a homeless service system. And street outreach really ensures that people's basic needs are being met in order to support them along, the pathway towards housing stability. So if you kind of think of, Maslow's hierarchy of needs, to really get to a point where they're able to be housed, we need to make sure that their imminent basic needs are being met. Street outreach is often, the first point of contact for folks entering into homelessness. And so it's really, I see it as one of the most important interventions within our system. Core principles of street outreach really should always include meeting people where they're at. And that is geographically where they're at, and it's also emotionally and physically. So, we want to ensure that we're going to the areas where folks are, and that we're going and approaching them in a way that's trauma informed, that's taking into account, mental health, substance abuse, those kinds of needs, those things that sometimes, when folks are accessing services, it can be a barrier for them to access those services if their mental health or substance abuse, if the behaviors, associated with that are challenging for service providers to meet. Already mentioned, meeting basic needs is a core principle of it. Really being respectful and treating everyone with dignity. Building a rapport on street outreach is probably the key piece to outreach engagement. A lot of the folks that outreach is coming into contact with are not accessing the traditional services, and it's often because they're weary of service providers, they're weary of the government, they don't want to be, they want to be off the radar. And so to be able to have those conversations about goals of housing stability, there has to be a relationship built between the outreach worker and the individual, and that can often take time, and it also takes really skilled outreach workers to be able to do that. So that's kind of an overview of what outreach looks like. Our current efforts, here in Lane County, we have two teams that are staffed by at least partially by Lane County employees. So the first one is our coordinated entry outreach team. That's currently a 2.0 FTE team, although we are looking to add an additional FTE this fiscal year. That team focuses on individuals that are currently on the coordinated entry housing list. So folks that are waiting to be referred to a housing program. And our outreach workers work really closely with those folks to help them identify what the barriers are to getting into housing, and really to ensure that at the time they're referred to a housing program, they have the documentation they need. So ID, verification of income. For some programs, it's requiring verification of disability. So the goal is really to ensure that we are getting folks housed successfully and in a shortened length of time. The other outreach focus that we have that is at least partially staffed by county employees is our rural focused outreach. And so we have two teams that are county employees, one team that is South Lane County and one team that is West North Lane County. So the South Lane County team covers between Eugene down to Cottage Grove, Cresswell, Goshen, and then our West North team covers Eugene to Florence, including Bonita, and then the north piece is Junction City and Coburg. To complement that, we also have our East Lane County outreach, and that's contracted out through Carry It Forward, the provider. And that includes the Springfield metro area, all the way east to Mackenzie Bridge. And then they also cover the Oak Ridge area within that team. There is, because that funding is COVID tied, there is a COVID prevention piece to it. Initially, it was getting PPE out to folks, talking to encampments about how they can best social distance. Now it's really about connecting folks to the vaccine and dispelling some of the myths, about the vaccine. That rural outreach is currently funded through December 31st of 2021. But it's a long-term goal of ours to keep that rural focus, that full geographic coverage of Lane County outreach, continuing beyond that. Another program that recently got started is our health-focused outreach. Sorry, I touched on this a little bit. That's contracted through HIV Alliance. It's really kind of the core principles of outreach, but then with an additional health focus. So they have a nurse practitioner on their team that can go out in the field, provide in-the-field medical treatment, can diagnose folks, can prescribe medications. And so it's really was a missing piece of our outreach puzzle, was that real health focused in the field medical care. So we're really excited about that. And then upcoming, Peter and I have been working really closely together on creating a City of Eugene outreach plan. I'm actually going to let Peter take over from here and talk a little bit more in detail about that plan.
Great, thanks, James. Good afternoon, Mayor, councilors, commissioners. Thanks for being here. So from the city's perspective, coordinated outreach brings together the separate but overlapping responsibilities our jurisdictions have when it comes to homelessness. So of course, one is to support people into more stable situations, particularly related to housing, income, health, and community connection. Also, we have a responsibility to maintain public spaces and rights of way. And so in FY21, the city utilized one-time dollars to pilot a street outreach team to navigate this challenging terrain while at the same time delivering high quality engagement to our unhoused community members and following the same principles that James just laid out. Learning from this pilot informed the collaborative development of the outreach RFP that is actually out. We're closing that on August 6th, and we're excited to continue outreach within the city of Eugene based on responses to that RFP. That contract is funded through CDBG CB3 dollars allocated to the city and ESG CD funds allocated to the county. So it's one really concrete example of how the collaborative work that's been going on, certainly since I've been involved in this work, which is 2019, continues, and the relationships that this collaboration has produced, I think, lend itself to a really exciting opportunity with this RFP. Dispatch of this outreach team will be a collaboration with James, the county's outreach coordinator, as well as city staff. We're looking to bring on a camping response manager who can help us identify high priority areas where outreach teams can be successful. Again, engaging folks where they're at, trying to understand what their immediate needs are, and help folks think about, okay, what's the next step for you in your journey to increase stability. So yeah, that's just a little bit on the city's outreach within the city of Eugene and the collaboration therein that's happening between the city and county. With that, I'll pass it back to you, James.
Really quick, if I can just insert, no, not to interrupt you, James, sorry about that, but we're really, we've hit time. And so I just want to be conscious of that. So our overview on this will be relatively quick, and then I'll probably need about 5 minutes to complete the rest of the presentation, if that's okay.
So yeah, just, with all of these outreach efforts that are in place, we have started utilizing or coordinating those outreach efforts via a case conferencing meeting. And that's a bi-weekly meeting that's has been happening since May. It's a convening of all of the providers in the community that are providing outreach. And it's really a way for us to coordinate and to focus and make sure that there isn't a duplication of services happening amongst providers, and that we're really ensuring that those folks in the community with the highest vulnerability are the folks that are being prioritized and then referred to available housing options. And case conferencing is really, as we talk about coordinated entry improvements, is really going to become the way that we start to send referrals for housing providers, and it's what's called the dynamic prioritization approach, rather than just referring based on a score on a vulnerability index. So coordinated entry, let's talk a little bit more about that. Coordinated entry is a process that is developed to ensure that all people experiencing a housing crisis have fair and equal access and are quickly identified, assessed, referred, and connected to housing assistance based on their strengths and their needs. And really, HUD has identified the 4 core elements of a coordinated entry system as addressing access, assessment, prioritization, and referral. So with our current coordinated entry process, folks access coordinated entry via what are called front door sites. And so those are several social service agencies located throughout the community where individuals are referred to go and have an assessment conducted. This model creates barriers because folks, need to figure out how to get to these sites. Oftentimes, they are not previously connected with the staff at those sites, and they are then kind of required to share pretty personal and intimate details about their life through this assessment process. And it's really not a trauma-informed way of conducting the assessment. So our goal moving forward is to really move towards a system that's accessible to anyone in the community at any time. This likely would be an outward-facing website where an individual themselves would be able to access that, a provider, a community member, and that would begin kind of the coordinated entry process. In addition to a website, likely we would have a hotline, and then we would also have our outreach teams, out in the field being able to connect folks either to that website or hotline or actually doing those initial assessments out in the field with those folks. In our current system, households are placed on the centralized wait list and then are prioritized based both on chronic homelessness and then a score that they receive on what's called the VI-SPDAT. It's a vulnerability assessment. That process has led to what are called referral buckets. And that concept is the idea that only the folks who are scoring the highest, or only the folks with those highest vulnerability scores end up being referred to the housing programs. Whereas the folks kind of with the lower range scores tend to sit in these buckets of referrals and they don't actually end up ever getting referred. So, an example of that would be somebody who scores an 8 would be on the top of the rapid rehousing list. So they would be, have the highest vulnerability for that housing designation. But somebody who scores a 9, that would actually bump them into permanent supportive housing range, but it would be the very lowest of permanent supportive housing. And so they likely would never be referred. But it's very possible that somebody, the difference between an 8 and 9 is so minimal, it's very likely that that person who scored the 9 could be served as well through rapid rehousing. So that's kind of the idea of dynamic prioritization. And it's really, the goal is to make all housing resources that are available to everyone in our system that needs to take in or needs housing. And it really will help to move the system and have people exiting off of the coordinated entry list and into housing a lot quicker.
Thanks.
Yep.
Sorry, I'm gonna move us along because I want to make sure we have plenty of time for comment.
Sure.
So thank you, and again, there's more information in your reports and etc. So the Navigation Center Low Barrier Shelter, of course, is a long-awaited project and it is underway. We're in a really tight rhythm right now. We are working with Pivot Architecture and KCL Construction on the architecture and engineering part of this building. And so we are moving at a pace where we're meeting every single Monday, getting decisions made as fast as we can and continuing to move it forward, working within cost constrictions and also especially a time constraint that is imposed by the state of Oregon as a condition of receiving the $5 million they allocated to this project. So this building and the program will be up and running by on or before July 1st, 2022. So we are working that really hard. And then the coordinated outreach and coordinated entry pieces of it all feed into how the referrals will work for the Navigation Center, making sure we're prioritizing the right folks, and then helping match them with available housing opportunities as they arise. The basic portfolio timeline looks like this. Those are some of our milestones. You have a copy of the slides. So I welcome you to take a look at that. And if you have questions or are interested in the details of our Gantt charts, feel free to let me know and I'd be happy to explain a little bit more about it. So looking at our status overall, as far as progress and implementation and kind of what we're doing, for prevent, I'm adding rent assistance in here because it is a big body of work that is happening within the Human Services Division. And so that is part of keeping people housed. Right now it's on track and it needs a bit of attention just because in diversion and rapid exit, we're really doing our first try at that. So we will have some tweaks and adjustments to make as we go, I'm sure. On support, the Navigation Center, coordinated entry, coordinated outreach, as well as training, all are on track. So that body of work is looking pretty good right now. We also, of course, in-house have Landlord Strategies, Rapid Rehousing. Rapid Rehousing is a yellow because we do have things that we need to work on, as I mentioned before. And then we've got tenancy supports, Move On, and PSH moving forward at a pretty good clip. So overall, some of these projects, really the majority of these projects are stalled and or need resources. So it's going to be a bit of work for us to get there, but we want to be honest about that and take a hard look at what we're doing and how we're prioritizing. So thank you so much. I'm going to stop sharing and turn it back over to you, Mayor Venus and Chair Bernie.
Thank you. I don't know whether did the city manager, do you have any closing comments that you needed to make?
No, I think that Sarai did such a great job on that, and I just look forward to the conversation. I may at the end of the whole deal.
Okay, great. So as you all will remember, the way we operate these joint sessions will alternate a city councilor to county commissioner back and forth. Everyone will have 2 minutes for the first round. And when we get to a second round, if we have time, you'll get 1 minute for your second round. And so the first person I have on the city council list is Mike. So Mike, take it away.
Thank you, Mayor. Thanks, Sarai, for that presentation. The actual presentation itself was laid out in a way that made it very easy to understand, and it was incredibly well done. Thank you very much. Just a few questions. James, you mentioned a lot about the outreach work. My first question was, where do you usually conduct outreach? Where do you usually engage people?
It really depends. I would say, the goal is always to engage them where they are at and where they're staying. So it's, it's actually going out in the community. Our teams often will go out just on foot and walk through a community and try to engage folks that they come into contact with. We also work really closely with providers, especially in the rural areas, because rural homelessness looks a lot different. So we build relationships with providers that then kind of tell us, and law enforcement as well, they'll let us know where there's an encampment or where they're seeing folks congregated.
And that's really my question. Do you encounter most folks while they are camping in an unsanctioned area?
We encounter most folks when they're camping, whether or not it's an unsanctioned area. I think it's a mix of both.
What would you call the percentage of those you encounter camping in an unsanctioned area?
I'd really have to ballpark probably 70 to 80%.
Well, sounds like a lot of them. Sounds like most of them. Can you tell me, you expressed that many express weariness to engage with government. There's trust issues. There's reasons for that. What percentage of those you engage express weariness?
I really couldn't attest to that. I don't know. I think, it's a common kind of, HUD has identified that, across the country as being sure. a barrier. I couldn't say definitively a number.
Is it most?
I don't think it's most. When we look at the data, so, when we look at HMIS, the folks that are being contacted by outreach often are in that system already. And so, I think there are folks, to say they're weary of it, they might still be accessing those services, but they're not going to be as willing to really engage in the in-depth conversations that lead to housing, because they don't want to share that information with someone that they haven't built a connection with. And so that's, I think, the piece that outreach is really able to address, is to build those relationships with them where they're at, creates a different kind of relationship in many ways.
What I'm trying to get at is subtly different. My concern with our strategy has always been that I think we are doing an incredible job of providing support. I think that the plan and the actions taken are amazing in depth and thorough when it comes to offering the opportunity for support. I think we fall down in having less requirements for behavior amongst those unwilling or weary of engaging. That's our biggest problem, in my opinion. And I think that at least the city should engage on our expectations and say, what do we expect of minimal behavior in unsanctioned camping? And we don't do that part. And that's where I think we fall down. Last question, on this model, at what point and what year do you think it possible that we end unsanctioned public camping in Eugene? Yeah, that's right, I think.
Yeah, I don't think James has to do this one. I think that our reality is that there isn't a simple equation to say by this time we're going to have no more unsanctioned camping or no more homelessness in our community. It really is.
Yeah, and I don't believe that we'll ever end homelessness at all. My question is unsanctioned camping.
Mm-hmm. Right. So I think the broad answer to that is when we have enough places for people to go that are safe for them to sleep and they're allowed to be, then the enforcement of unsanctioned camping can become a thing. And so right now, what we really have to look at is what is the opportunity for us to create space for people to go? And this is largely because of the Boise decision and also because of the reality that we simply have underbuilt housing by the tens of thousands for decades. Mm-hmm. And so there are just not enough people for everyone who lives here or wants to live here to be right now.
I'll address that in my second round. Thank you, Mayor. And thank you, sir, James.
Carrie, you're muted.
You're muted, Joe.
I'm so sorry. I want to first, before we start with commissioners, thank every member of our board for during our down week accommodating the schedule change that we had. So with that, Commissioner Buck.
Thank you, Chair. I had a couple of comments. First, I wanted to thank you on the presentation for adding those budget items. I've been asking for some breakdown of budgeting and who's paying for what as we go, and I think that's a great start. I think there's more that we could do to break it down and expand that further, but I really appreciate that part. The other part that I wanted to mention is, you know, TAC report's been around a while now. I actually consider it a stale document at this point. And we need to consider whether we want to update that report. It has been, you know, a report that's a goal for both the county and the cities. And it's important to be able to try to achieve the goals in that report, but it will continually need to be refined as the years go by. So I want to put that out there to everybody who's watching and attending the meeting, because I think we need to do something further on that. And I appreciate all the work that has been done so far, but we will have to continue to do more work. And the 350 permanent supportive housing units, I've always felt was never going to be enough to satisfy even the numbers we had in the beginning of the TAC report, let alone the numbers that we now have when we count in our new way of counting. And finally, I want to just share, you know, we really need to come together and find a way, instead of being more siloed in the county and the city and of Eugene or the city of Springfield, but find a way to do a lot more collaboration together. We used to have committee meetings or subcommittee meetings with some staff on both sides. I was part of that. And I really like to see that continue and find a way where we can come together as a group, not just these periodic meetings, but in an ongoing way to ensure a regional approach as we continue our work on the unsheltered. Thank you.
Thank you. Brandy.
Thank you, Mayor, and thank you, Sarai, James, and Peter for an excellent presentation. I think that was a great background of what we've done and where we're going. I agree with Commissioner Buck that we need to do more interagency collaboration on this and other things. I want to thank James for referencing Dr. Abraham Maslow's hierarchy of social need or progression. I think it's a great framework for how we approach our unhoused challenges. I also want to say that I've spent a considerable amount of time out in the community, especially West Eugene, where my ward is, meeting with people, speaking with the unhoused, speaking with the businesses, speaking with the workers and residents in the area that are also impacted by this. And I think as we develop our strategies and employ our tactics to accomplish this work, that we need to make sure that we are taking into account not just the unhoused, but the whole community and how it is impacted. I think that's important for our community to be accepting of this and also supporting the work. I'm interested in trying to think proactively and getting back further in the pipeline. I know there was a lot of talk about rapid rehousing, but what are we doing to try to help those who are about to be evicted when the moratoriums stop? How do we prevent more people from being introduced into our unhoused community?
I'd love to see if Steve Manella, if you would like to speak to that. Right now, our primary intervention is rent assistance, and Steve knows a lot more about that than I do.
So, good afternoon, City Council and Board of Commissioners. I'm Steve Manella, the Human Services Manager at Lane County. We're in the process of deploying $47 million worth of rent assistance throughout the community with community partnerships with a number of nonprofits and Homes for Good, the housing authority. Also, there's been a landlord partnership program operated by the state of Oregon. And then we will get another tranche of Department of Treasury funding that came through the RL legislation, both locally as Lane County and the state, that will probably be around another $25 million. And we have put in place, taking from some of our COVID efforts with our public health division, we've put up some pop-ups and doing outreach with various groups at various locations in the community in order to enroll people. And we have both a phone number that people can call and landlords can call, as well as we have a website and access for people who can access by web. We also have walk-in capacity at all those community agencies that I mentioned.
Thank you. That helps. I'm also hoping that we will hear something back from our Housing Policy Board with some recommendations for what we can do about this and into the future. And then the last initial question I have, I see my time is running out. I think it's very important that we determine ahead of time what we are going to do once we have adequate capacity in these camps to address those who refuse to move onto the site, so that we don't continue having illegal occupying of public and open spaces. And that's a comment. I don't need a response on that for now. Thank you.
Thank you. Thank you for your holistic remarks, Councilor Groves. Yes, Commissioner Trieger.
Thank you so much. Good afternoon, everyone. I'll begin with just a really quick clarifying question. Sarai, the number of diversion specialists, you have 3 of 6 FTE. Are those City of Eugene, Lane County, some of each? Can you share that? That's my quick question.
Yeah, those are actually shelter care staff. So there's 2 full-time and 2 part-time staff associated with this contract.
Contract through Lane County?
Yes.
Thank you. Now my longer question, picking up on Commissioner Buck's comment about the TAC report. I think it's still a useful basis, but I agree it's a bit of a stale document. First of all, just time-wise, but second of all, COVID, displaced wildfire survivors, racial reckoning and the strain on staff at both our organizations as well as our service provider community cannot be underestimated. And the thing I notice that is a glaring omission from the TAC report to me is staffing resource and capacity, specifically the human capital, the human infrastructure that it takes to actually accomplish the work, whether that's with our community-based organizations or our own organization staff. So something I would like to see if we do an update and a retool is to specifically call out those human capital needs, recognizing the increased strain and stress on staff in addressing ever increasing and deepening levels of need and mental health crisis of the people to whom we are reaching out cannot be underestimated. And workers' own challenges with workforce who are themselves affected by COVID or wildfire displacement and racial injustice in our community that they're experiencing. I just think it's a huge gap in the report of our capacity and our resource and our infrastructure. So I'm wondering where, if we're going to update the TAC report or add on to it or freshen it, that work is going to live. And I think part of the answer, as also Commissioner Buck mentioned, is these updates are great, but they're not that frequent and we don't actually move work forward. We get information and then we have information, but what we're actually doing with it as a joint body to make some decisions and move the work forward, I would very much like to be a part of that and see us prioritize that structural change. Thank you so much.
Thank you. Alan.
Thank you, Mayor. Sorry, beautiful slides, by the way. They were visually very appealing to look at for a really tough, sometimes heartbreaking problem. A great presentation, by the way. I've been working on these homeless issues since the early 90s. This is the most coordinated we have ever been. We have the best and clearest plan that we've ever had. And we have accomplished a lot in the past, but I think the TAC report, I agree, a little stale and needs to be updated, but the work that we're doing actually, I think, is the update. But I think that the TAC report catapulted us forward with the alternative shelters and the low barrier shelters and permanent housing. 170 units over the next 2 years is just, for permanent housing, is just spectacular. And then we're finally getting some assistance support in terms of dollars from the feds and the state. I know this has been a City of Eugene, Lane County focused presentation. I'm wondering where the City of Eugene fits in, or City of Springfield fits in all of this. I agree with Commissioner Buck. We do need a regional approach to all this. So maybe a couple of people could comment on that.
Thank you, Councilor Zelenka. 100% agree that this has to be a regional effort. I think if we focus on only one location and don't focus on any others, we're kind of creating a self-fulfilling prophecy of this is the one place where you can go. And I think what we also see is a number of other communities throughout the county are willing and interested in coming to the table. And City of Springfield has done some great things this year. We're able to move some pallet shelters in on a site owned by Mainstream Housing. They also have supported street outreach with a contract with Whitebird and have done a number of other things since the COVID-19 pandemic to work toward this. And so I think we have a really great opportunity to loop Springfield into this in a really meaningful way. Especially if we are talking about sort of broadening that frame beyond just these 10 recommendations into how do we build this system to work for everyone throughout our community. And I'm certain that we would get other municipalities to participate as well.
Yeah, I think it's time to formally ask City of Springfield to join this collaboration so we can have a truly regional path forward. I really support the housing first model, and contrary to some people's belief, this is not a Eugene only problem or Lane County only problem. Every significant city on the West Coast is experiencing similar stuff. It's a symptom of lack of affordable housing, as people have mentioned, lack of mental health services that people have mentioned, lack of substance abuse services, and it's been baking for decades with a lot of neglect. And we've been working on this and for years, and it's finally gotten to the point where we're getting people's attention because it's bad enough and it's in their face.
You're over, Counselor. Are you going to ask a question?
Not yet. So I'm glad to see other people trying to get involved in this. A little late to the game, but if they're interested in solutions, I'm more than willing to have people play with us.
Thank you very much. Commissioner Farr.
Thank you, Chair Bernie. You know, a couple of things really quickly. Alan, you're right. You were here in the early 90s when Ruth Bascom was mayor, long before Betty Taylor was ever elected to the Eugene City Council. You've been around a long time. I've watched you and I admired your work. Regarding the TAG document and its staleness, actually, before I say that, Sarai, I'm sorry you had to shorten everybody's presentation because that was by far the best part of what we're doing today is hearing what is going on. I wish we could have gone on a long time and finished that, particularly the equity part, which we skipped over. But the TAC report is stale, like a loaf of freshly baked bread. TAC became stale the day after it was baked, the day after it was published. It's day old already. But you know, we've got to use it. We've got to toast it. We've got to make bread pudding out of it until we have something different. You know, it is what we have. And we really can continue to work on the things that are being outlined today in a collaborative fashion, Commissioner Trigger, more frequently together, Commissioner Buck. Very quickly, this is the question I'm going to ask. We have, for decades, underbuilt housing. Sarai, you said that. How are we going to counter that? What are we going to do? That's my question, but first I'm going to make a statement. Counties granted carry it forward use of property, which was formerly Camp 99. It's evolved into living spaces for a number of people beyond the original intent of Camp 99 and beyond what they were intended to do. How does it count toward the number of beds that we're providing in the community? And better, more importantly, how do we use that particular model to allow our partner agencies to more effectively use public land? Councillor Trigger, you and I have an outstanding request for the inventory of public land that's available in and around the metropolitan area. It's not the first time it's been asked for, but it's never been given to us. If we can identify that, then Councillor Clark, we can get to your question. And your question is, how do we emphasize behavior of the people who are camping in particular camps? That's a question that's being asked by a lot of business folks in West Eugene right now. We're all going to be answering that question at some point, and it's the question is going to get louder and louder and louder until we do something about it. That's all very quick and brief questions, but how are we going to quit underbuilding houses? How are we going to do it? Answer the question, Sarai. You're on you're on the grill. I know there's no answer for it, but that just is rhetorical. What are we going to do? Thank you.
Okay, Naya, I believe that we have a Matt Keating on the phone. Can we hook him up for to speak?
Yes, one moment, Mayor.
Thank you.
Councillor Keating. You should be able to talk.
Great. Thank you, Naya, and thanks, Mayor, for the opportunity to participate in today's collaborative work session. Commissioners, thank you for joining us, and thanks for allowing me to participate telephonically. I wanted to hone in on a couple things. Well, three things in particular. I agree with Commissioner Buck and others who stated that refreshing the TAC report is paramount. And Monday evening, our municipal judge, our police auditor, and our city manager presented us with a matrix for tackling police recommendations from the ad hoc committee on police reform. And that particular matrix could be a worthwhile model to explore TAC 2.0. The other thing I want to talk about is removing barriers. And I would like to have a larger conversation the next time we gather about removing barriers outside of the assistance cycle and try and get folks out of that assistance cycle and remove the barriers that renters have in our community, period, including but not limited to a pool wherein renters can apply once rather than applying a dozen times to try and find a place here in Eugene, including but not limited to removing barriers about the last 3 addresses in the last 7 to 10 years, removing barriers that ask about bankruptcy, anything that could be a negative mark on the prospective renter. I would like our 2 bodies to explore creatively with our statewide partners and what we can do right here within our own municipality and within our own county to allow folks to have access to capital A affordable housing and housing that is small a affordable. And finally, I want to thank county partners who stepped up just 2 weeks ago at the spike of the heat dome event to allow for cooling centers and emergency respite. And I'm thrilled that the conversation will be a centerpiece of our next Human Services Commission meeting. But I think we need to talk more openly about what I'm just calling, just back of the napkin, a reverse EUGENE approach that allows for cooling centers throughout our community, whether it hits 100 degrees, and what those cooling centers look like throughout Lane County, and how we take the cooling center approach to the folks most in need. So in addition to having community centers and the library and the rec center and Lane County Fairgrounds, how do we go where people are so they don't have to leave their belongings and help our most vulnerable community members who are on the streets, who suffered most recently in the last heat dome event. There are hundreds of Oregonians who perished, and I'm not necessarily clear on how many folks suffered heat related events here in Lane County.
Yeah, you're way over. I apologize.
My apologies, Mayor.
I totally.
I can't.
You can't see it, and it's my fault because I wasn't watching. I apologize.
I won't take a second round. I just want to say thanks, and I'll listen to the rest of the meeting.
Thanks. My apologies.
Thank you, Mayor. I didn't know how to do that gracefully. I guess I'd like to make a couple of comments. And the Eugene City Council members will see that I'm often in the minority. I don't think the TAC report is stale. I actually objected to it in my first meeting as a county commissioner 2.5 years ago, when I learned that it did not even incorporate the homeless students each school district was reporting in terms of the assumptions and the data upon which a strategy was developed. I really also want to say I appreciate the incredible passion of staff trying to make this work. This feels so governmenty to me. And I think that in many cases, we need to build up people, not build up systems. I understand that systems support people, but even Mr. Councilor Keating's remarks talking about not demeaning people, again, if the principle is empowering people, not necessarily systems, unless that's a step to empowering people, that I'm just providing that one piece of input. I have to say this, forgive me, but I actually didn't like what I perceived to be arrogance in a remark saying that we should get the city of Springfield as part of this. The city of Springfield has had ADUs for a long time now and waived system development charges. In the city of Springfield, I was proud to participate in ensuring that 86 families at the Patrician Hotel, Patrician Manufactured Home Park, now the Filbert Grove Cooperative, were not made homeless. We prevented homelessness. I think when we go to another entity, we need to take this silo mentality out of our heads and put a partnership mentality into our heads and look at the strengths the different people and entity bring to the table and build on those strengths. Not saying this is our game, come play in it, especially if we're looking at regional cooperation. And finally, and I know I'm over now too, but I won't be over by too long. Finally, ultimately, without safe and secure housing, we have to ask ourselves, what's a lot of this intermediary work? What's the effectiveness of it? So I hope that we as a group look at home share as a part of what our homeless strategies is. And my time is up. I apologize. Thank you very much for allowing me to speak.
Thank you. Claire.
Thank you, Mayor. Well, I was feeling really good about this meeting until a moment ago. So first, I want to appreciate the presentation and all the collaborative work between city and county staff to keep us moving forward on this work. And I will agree with Commissioner Farr that I would have been fine with seeing more of the presentation and having less time for all of us to make our comments. I will say right now, I was very disappointed to have some in this meeting take offense to my fellow counselors' comment, which I suspect was meant purely in the spirit of collaboration and not as a criticism. When the city and the county embarked on this path, the city of Springfield deliberately chose not to be part of the Technical Assistance Collaborative Report. That was a decision they made. We respect that decision. And now I understand there's a county commissioner here from the city of Springfield who has strong feelings about this, but this is where the collaboration has brought us to. I want to appreciate Sarai's work and the presentation that points out how important it is to have a single person who has a handle on the various aspects of this work, because there are so many areas that interdepend on one another and intersect. So I really think getting the position that Sarai holds in place was a really critical part of the work. Speaking of interdependency, addressing the issues of mental health is a factor in our ability to reduce homelessness. So I'd like to get more information about the mental health summit that was listed on a slide. And lastly, I raised the idea of formally revising our goals in the TAC, I think over a year ago at a joint meeting like this one. So I agree with the commissioners who have said that we should perhaps do a formal update. Thank you.
Mayor, at this time, I know do you have city councilors that have not yet spoken?
Only myself, and then we have a second round. So I'll just jump in for a minute and then we can do second rounds. So I first of all, I want to appreciate this presentation also, which was really interesting and very detailed. I appreciated the breakout in the chart, in the appendix of where we spent money, where we haven't spent money, where it's progress. I just think it's an excellent update, and it does point to the comments that people have made that this TAC report was. I'm sorry, Sarai, I know you hate it when we call it the TAC report. That this report. It was built basically on old data. And as I have observed a number of times as well, we have a much larger population of people who are unhoused than we really anticipated in this report. And so it feels naive in that way. And I also appreciated the fact that you incorporate all of the alternative strategies that we have invested in over the last year through COVID, as this is part of the ongoing work. And so it points to two things for me. One is that your closing comments about capacity and capacity building, it's staff capacity, it's our nonprofits capacity. In my mind, it's very much, I'm excited about the city's RFP on outreach capacity, and just want to acknowledge that I don't know how, I mean, that is enormous, that we are going to be serving 2,000 people living in public spaces for the foreseeable future. We're just not going to move them through the system that fast. And so it feels to me that capacity is a priority. And then finally, a quick comment. We did have a steering committee when we first looked at the implementation of the TAC report, and hearing what people are saying, propose that kind of steering committee could come back again with county and city leadership, crunching through some of these things that we might want to revise or update.
Mayor, I don't see any commissioners that want a second round. at this time.
Okay, well, in that case, we'll just start and see. So I have Mike for a second round first.
Thank you, Mayor. Appreciate it.
It's 1 minute. So thank you. Timer. We're going to 1 minute. Thank you.
It's in a minute and a half after Alan, but yeah, okay. The first thing I want to say is that I'm absolutely not picking on Soraya. I think you're awesome. I think you do fantastic work. I'm so glad you're doing this, but I want to ask the city manager a question. And the reason for the question is, I suspect that others in this meeting, I know I get a question almost every day. When are you going to do something about homelessness? Which is one of those questions that kind of has behind it the assumption that we're not doing much, when clearly we've just had a report on the massive amount of things we're doing. But there's a disconnect between what the public sees and what they're experiencing and what we're doing. That seems pretty clear to me. And for me, a lot of that comes from the fact that there's a great deal of unsanctioned camps that don't seem to diminish. So manager, I'm not picking on Sarai, are you okay with that answer, that we're going to have unsanctioned camps for the foreseeable future and it won't change?
Yeah, thank you, Councillor Clark, for asking that question. And it's such an easy one, so I'll try to answer it in 1 minute. I think there's a couple of things I just want to say. There's been kind of unsanctioned camping in our parks and right-of-ways since I started working for the city in 1996. So there is, I think, always going to be, or for the foreseeable future, probably people seeking shelter in our parks and right-of-ways. And I think what you're getting at is, okay, but are we going to just allow that? At what point are we going to start enforcing? And what I have observed is that we've been in a very thoughtful place as we've been in COVID to try to really balance the needs of the community and this population as we've been following kind of CDC guidelines. And I think we've tried to be really upfront about when we are and aren't going to step in and enforce. And I think when those CDC guidelines change, we're going to need to have another conversation, because the policy direction is actually already pretty well established around what's legal and what's not legal and what's in the rules and not in the rules. And we can't just disregard that, right? Right now we are following the CDC guidelines. We come out of that, I think you'll see us continue to be very thoughtful, but I don't think we would be following current policy if we just allowed unsanctioned camping forever. So it's a tough question. It's also hard to answer well, but I think we've got more discussions ahead of us.
Lastly, to the staleness of the document, I'd like to see us clarify our goals. What's the goal of the work we're doing around homelessness? Thank you.
Mayor, I couldn't tell. Commissioner Fard, did you want to make a second round comment?
Yes, but I'm not going to. Let everybody else talk. Thanks.
Sorry, Mayor.
Oh, no, it's a commissioner's turn, so that's fine. If no commissioners, then Alan, you're up next.
Yeah, thanks. I totally agree with what you said, Mike. The lack of communications, but this is rampant in all of city government, about our accomplishments, telling our story, what we've been doing, really leads to the issues that we're talking about, but also contributes to the perception that we're coddling and enabling homeless lifestyle with these services. So I think telling our story and what we're doing and why we're doing it and what's accomplishment is a really good idea. As for our city of Springfield, my comment was that we formally asked Springfield to join this collaboration. They chose not to be participating in the TAC report, and this has been just the two jurisdictions. For it to be truly regional, let's invite them to the table and have this be a three-way meeting and have everybody at the table, and then we can all talk about this and share notes and share accomplishments. I did want a little bit of clarity about what an updated TAC report looked like. I thought the updated TAC report was the implementation plan process that we just went through, so looking at if it's looking at new different things as opposed to updating numbers and their perceptions, I don't know that we're going to get that far. We can't even do what we're trying to do in the plan, much less add a whole bunch of new things. But if it's updating it to get there, I'm maybe Commissioner Buck and Trigger can talk about what they were thinking.
And Mayor Venice, I do see Commissioner Farr does want to have a second.
Thank you, Chair Burnett. I'll be very, very brief. I had not intended to speak, but Springfield is at the table. They're the Human Services Commission, they're the Poverty and Homelessness Board, they're the Mental Health Summit. Another Mental Health Summit, I don't often see the city of Eugene there. So really, Springfield is at the table, but I think like everybody is saying, it's time for us to really weave together our fabric of collaboration. This is the time we've got to do it. Thank you.
Thank you. Claire.
Thank you. Well, the one thing I didn't get to say in my first round was around the capacity building for our providers, which Sarai, you said you were going to speak to further, but I think you might have cut that part short. And I would like the elected officials on these two bodies to consider how we might put pressure on our state and federal decision makers to increase funding, such as through HUD, or reconsider limitations on how funding is used so that our local service providers can provide wage increases and other compensation to their staff so that we can have a more stable workforce within these important service providers. So we can't be expected to generate all of those revenues locally. And then I think in terms of updating the benchmarks in the TAC report, my personal view is that because we now have more refined numbers, I think we should be reevaluating those benchmarks numbers that we had laid out 2 years ago in light of that.
Thank you, Councilor. I'll take a stab at a second round if I may. I want to say first to Councilor Zelinka, I'm delighted that I misread the intent behind your comment. Thank you. And I want to share that part of that was because a couple of times I've requested this body include the city of Springfield and invite them to the table, and this body declined, and it related to payment for the TAC report. So I'm just going to assume that we're all in unison, that we're united, that we will be inviting both the city of Springfield and perhaps other communities in the county, and I thank you all for that very much. Mayor?
Okay, thank you. Any other counselors? I have some counselors who didn't take a first round, so I'll keep that window open for that. If not, we actually have a few more minutes, and I don't know, were there some things, Sarah? Oh, there's Counselor Semple. Go ahead, Emily.
I really appreciate the report and having it all in one pot so we can see how much we have done. It's really a lot, and we tend to talk about single things, which are also good, but as we all know, the community is beyond frustrated on all sides, and as much as we're doing, which I think is as much as we can do right now, it's not enough. So our plans and thoughts for reaching out to get more money, I've always been super concerned about mental health care, and finding providers, I think is a really big problem. So I'd like us to make sure that gets bumped up to the top, because I think that that would make a big difference. I really appreciate everybody's comments. I kind of sat back, but to listen what you're saying, I agree with the outcomes that we need more, and also that the directions we thought we were going in the beginning, like most travels, have veered from the path we expected. And as much as we plan, it will continue to do that. But I do applaud the efforts, and the thing I take from this is, yeah, we are doing a lot. And I think if we could do more, we would. And if people have ideas of what they think we should be doing that are fair and equitable and look at both sides, please come forward and help us, because we still need everybody. So thank you all very much.
Thank you very much. I'm wondering, we have 5 minutes left. I don't know, Sarai, did you have a couple of other comments that you wanted to make that we didn't give you enough time to share?
That is an excellent question. I think we covered all of the main things that we needed to talk about. but I mean, ultimately, I would love to just express my thanks for this conversation. And I think you've given us a lot of new direction to consider and think about. So I look forward to getting together with Steve Mokrajski and Sarah Maderi and everybody else to identify some ways that we can move this forward. Yeah, and I think you're right in noting and suggesting that we are looking at an ever-evolving animal when it comes to what this looks like in our community and how many people are experiencing homelessness in so many different ways. So I am hopeful that we can work together in effective and efficient ways to move a lot of these projects forward and to engage the community differently.
Thank you very much. If there are no other councilor comments, I can formally close the city council meeting and turn to my colleague, Commissioner Burney, to close the Board of Commissioners.
Are there any other commissioners that would like to make a statement before we close?
Oh, oops, I have a counselor who still has another hand up.
But your meeting's over. No, I'm just kidding.
Emily,
you'll like it. You know, the council is going on our beloved and way looking forward to summer recess break, and we're going to come back even more energetic. And I just want to take the chance to wish all of us and all of you and the city and the county a really happy summer. And if you haven't gotten your vaccine, please do it. Thanks.
Thank you.
Is your meeting now closed, Mayor?
Okay, now I officially close the city council meeting. Thank you.
Thank you. Are there any other commissioners? Seeing none, thanks. The meeting of the Lane County Board of Commissioners is also adjourned. Thank you, everyone, very much.